There are things couples have been told for generations, passed down through families, shared in whispers, repeated as absolute truth. And some of them are quietly doing more harm than good. Today, we're going to talk honestly about something that matters deeply to every marriage: physical intimacy, not from a place of shame, not from cultural pressure, but from a place of real, evidence-based understanding. Because what you don't know can genuinely affect your health, your relationship, and your future. Across the world, married couples carry questions they're too embarrassed to ask a doctor. Questions about hygiene, about comfort, about what's normal and what's not. And in the absence of accurate information, something fills that space: tradition, folklore, and well-meaning advice from people who were never trained in medicine. A grandmother's remedy, a neighbor's suggestion, something read in an unverified article online. These pieces of advice travel fast. They feel familiar. They feel safe. But feeling safe and being safe are two very different things. This video exists for one reason: to replace confusion with clarity, and to give you information grounded in what medical science actually says. No judgment, no shame, just truth. Let's start where most people start: cleanliness. Good hygiene before and during intimacy is genuinely important. Not because intimacy is something to be ashamed of, but because the human body deserves care and respect. For both partners, gentle washing with mild, unscented soap and warm water is sufficient. This is a point worth emphasizing: unscented, mild. The genital area, particularly for women, has a carefully balanced environment of natural bacteria and pH levels. This balance is not a problem to be solved. It is a protection system. Heavily perfumed soaps, scented wipes, or aggressive cleaning products can disturb this balance, leading to irritation, infections, and discomfort. Simple is better. Clean does not mean chemically treated. For men, basic hygiene: washing thoroughly, including under the foreskin if uncircumcised, is equally important. Poor hygiene in either partner can lead to bacterial or fungal infections that affect both people. Urinating after intimacy is a recommendation many healthcare providers make, particularly for women. It helps flush the urethra and can reduce the risk of urinary tract infections, which are more common in women due to anatomy. This is a small habit. It costs nothing, and it makes a real difference. Here is something that does not get discussed enough in traditional conversations about marital intimacy. Comfort matters for both people. Physical discomfort during intimacy is not something that should be normalized, ignored, or endured. It is often a signal from the body that something needs attention. For women, discomfort or pain during intercourse can have multiple causes. Insufficient natural lubrication is one of the most common, and it is also one of the most fixable. Natural lubrication varies based on hormonal levels, stress, hydration, the stage of the menstrual cycle, and overall health. It is not a reflection of desire or emotional investment. It is a physiological process, and it fluctuates. When lubrication is insufficient, friction increases. And sustained friction on delicate tissue causes microabrasions, tiny tears that may not be visible or even immediately painful, but that create an entry point for bacteria and infection over time. This is where appropriate, medically safe lubricants become relevant. Water-based lubricants are widely recommended by gynecologists and sexual health professionals. They are compatible with the body's natural environment. They do not carry the risks associated with oil-based products, and they are effective. Now, and this is important, many people turn to home alternatives. Cooking oils, petroleum jelly, coconut oil. We'll address those directly in a moment. But before that, consent and communication. Intimacy in marriage does not remove the need for communication. It increases it. Both partners should feel safe to express discomfort. Both partners should feel heard when they do. A marriage where one person consistently feels unheard or uncomfortable in their most private moments carries a weight that builds quietly, and it matters. Mutual understanding is not a luxury in a healthy marriage. It is a foundation. Let's talk about the advice that travels through communities, the suggestions that feel trusted because they come from trusted people.
Coconut oil, olive oil, almond oil,
Jai, various herbal preparations. Foods believed to enhance fertility or improve experience. These recommendations are widespread, and the people who share them often share them with genuine care. But care and accuracy are not the same thing. Oils as lubricants, what you need to know. Oil-based substances, including natural oils like coconut oil, are not recommended for use as intimate lubricants, particularly for women. Here is why. The vaginal environment maintains a delicate pH balance, typically between 3.8 and 4.5, which is slightly acidic. This acidity is protective. It keeps harmful bacteria from overgrowth. Oils can disrupt this pH balance. They can coat the vaginal walls in a way that traps moisture and creates conditions favorable to bacterial overgrowth and yeast infections. Additionally, for couples using condoms as contraception, oils degrade latex. A condom exposed to oil becomes structurally compromised. It may break. This is not a theoretical risk. It is a documented, well-established reality. So the question is not whether coconut oil is a natural product. The question is whether it is appropriate for this specific use, and the answer from medical science is, it is not recommended. Petroleum jelly Vaseline. Similarly, petroleum jelly is not suitable as an intimate lubricant. It does not absorb into the body. It is difficult to clean effectively. It carries a high risk of disrupting the vaginal environment and is strongly associated with bacterial vaginosis in studies that have examined this question. Foods and fertility myths. Across many cultures, there are beliefs about specific foods that improve fertility, enhance libido, or strengthen reproductive health. Some foods do support general health, and general health supports reproductive health. Adequate nutrition, healthy weight, hydration, and management of conditions like diabetes or thyroid disorders all have documented effects on fertility. But the idea that a specific food or combination of foods will cure infertility or dramatically improve reproductive outcomes, that is where the evidence becomes thin. Fertility is complex. It involves hormones, anatomy, genetics, timing, age, lifestyle factors, and sometimes conditions that require professional medical attention. No single food resolves a structural or hormonal fertility problem. If a couple is experiencing difficulty conceiving, the most important step is consultation with a qualified healthcare provider, ideally a reproductive endocrinologist or gynecologist, who can conduct proper assessment. Self-treatment based on unverified remedies can delay that consultation. And time in fertility matters often does matter. Let's talk about what the evidence actually supports when it comes to reproductive health and healthy intimacy. Cycle awareness. Understanding the menstrual cycle is genuinely useful for couples who are trying to conceive. Ovulation typically occurs around the midpoint of the cycle, though this varies from person to person and cycle to cycle. There are various methods of tracking ovulation: basal body temperature charting, ovulation predictor kits, observation of cervical mucus changes. These tools, used consistently, can help couples time intimacy more effectively when pregnancy is the goal. However, cycle tracking is not a reliable method of contraception. This is a common misunderstanding. The fertile window is not always predictable, and there are too many variables involved for cycle tracking alone to function as effective birth control. Frequency and health. There is no single correct frequency of intimacy in marriage. This is determined by mutual agreement, individual health, life circumstances, and the dynamic of the specific relationship. From a health perspective, regular sexual activity has been associated in research with a range of potential benefits: stress reduction, immune function, cardiovascular health, emotional bonding. But these are associations, not prescriptions. The right frequency for any couple is the frequency that works for both of them. Even within marriage, awareness of ST1S is medically relevant, particularly when either partner has a history of previous relationships or when either partner is showing symptoms of any genital condition. Open, honest conversation with a healthcare provider and testing when indicated is always appropriate. When to seek professional help. Pain during intercourse that is persistent should not be normalized. It should be investigated. Conditions like vaginismus, endometriosis, pelvic inflammatory disease, or hormonal imbalances can all cause pain during intimacy. These are medical conditions. They have medical treatments. Suffering in silence or attributing pain to personal failing is neither necessary nor appropriate. For men, persistent erectile difficulties, pain, or unusual symptoms likewise deserve medical attention rather than shame-based avoidance. A doctor's office is the right place for these conversations, not a place for embarrassment, but a place for answers. There's something worth acknowledging here. The reason misinformation spreads so easily in this area of life is that this area of life carries the most emotional weight. Intimacy touches identity. It touches self-worth. It touches the deepest fears people carry about being enough, about being healthy, about being loved. And when people are vulnerable, they reach for familiarity. They reach for what sounds natural, for what comes from someone they trust. This is deeply human. It is understandable. But it also creates a space where inaccurate information does real damage, because the emotional stakes make people less likely to question what they've been told and less likely to ask a doctor questions that feel embarrassing. One of the most protective things a couple can do for their health is build a relationship with a healthcare provider they trust, a gynecologist, a family physician, a reproductive specialist, someone they can ask the actual questions they carry. Embarrassment in a medical consultation is temporary. The consequences of acting on inaccurate medical advice can last much longer. Healthy intimacy in marriage is not just physical. It is built on communication, mutual respect, shared knowledge, and the willingness to prioritize both partners' well-being. It means having conversations that may feel uncomfortable at first about what feels good, what doesn't, what concerns exist, what questions remain unanswered. It means choosing accurate information over comfortable tradition when the two are in conflict. It means recognizing that seeking medical guidance is not a sign of failure. It is an act of care for yourself and for the person you've chosen to spend your life with. Traditional knowledge carries real value in many parts of life. But when it comes to the body to health, it must be balanced with evidence, with science, with professional guidance. That balance is not a rejection of culture. It is a protection of the people within it. Every couple deserves access to accurate, honest, shame-free information about their health. That information is available. It is accessible. And it begins with one simple decision to ask questions, to verify what we've been told, and to care enough about ourselves and our partners to seek real answers. Your health is not a matter of tradition. It is a matter of truth. And truth here is worth every uncomfortable conversation it requires.